The important thing is that you see each patient as an individual. I think by getting to know the people and being involved in their life, you become a better partner for talking to them about what their values are, understanding what they want to do.
The reason I came to Fox Chase was because it was one of the few cancer centers that actually cared about prevention.
There's a level of kindness here that's present that I haven't seen in other places that I've worked.
Fox Chase is really a special place because it gives me as much back as I give to my patients. I get great satisfaction out of helping people.
I'm a general surgeon.
I'm a radiation oncologist.
I'm a gynecologic medical oncologist.
I'm a surgical oncologist.
I am a radiologist.
I'm a hematologist.
I'm an interventional pulmonologist.
I'm a plastic and reconstructive surgeon.
I'm a gastroenterologist here at Fox Chase Cancer Center.
All I do is treat patients with hematologic malignancies, specifically leukemia and myelodysplastic syndrome. I see this every day. That is what I do.
All I do is focus on genitourinary cancers, both in research and in clinical practice.
Years ago, I changed the practice of implants from low-dose rate brachytherapy implants to what we call high-dose rate brachytherapy. I've done thousands of these procedures.
I live and breathe GI cancers. It's what I think about when I come to work, when I'm seeing my patients. And I really think that not only are we maximizing the best treatment option for a patient, but we're also maximizing their quality of life and making sure that the life that they're living through their cancer journey is the best it can possibly be.
Cancer care is not just a single episode of care. Cancer care is a journey, and the journey requires a team.
One of the wonderful things about Fox Chase is that we have a system of multidisciplinary tumor boards where we review every new patient's case with our gynecologic oncologist, medical oncologist, radiation oncologist, pathologist, radiologist, genetic counselors, social workers, and others to make sure that we formulate an optimal plan for each and every patient based on their own individual needs.
The urology team at Fox Chase is one of a kind. There's a collaborative spirit that is dynamic and helps us grow.
One of the things that I spend a lot of time explaining to patients and families is that surgery is oftentimes not the only cure for these cancers, that really we need to work as a team to figure out when chemotherapy needs to come in, when surgery needs to come in, and when radiation needs to come in. And it's that kind of teamwork that's really crucial.
When I see a new patient, I am the one who does the history and physical exam. I make the treatment plan. I discuss the treatment plan with the patient, but I have a full range of people on my team to help me take care of the patient. So it does take a village.
New technologies are really pushing their way into how we practice medicine. Places like Fox Chase are taking the lead on bringing these new technologies to patients in a meaningful way.
I've had the opportunity to see patients who were told they had 6 months to live, participate in a clinical trial, and have them have significant response, feel better, and be able to lead lives that they never thought they could.
More than half of the treatments that I have available for my patients were not available when I started. So just to have patients who needed the next thing and to be able to get it for them in the form of a clinical trial and then ultimately as an approved therapy felt really good.
Really pride ourselves on being thought leaders. Some of the ways that people communicate about kidney cancer, for instance, this renal nephrometry score that we developed several years ago is used worldwide.
It was important for me to practice in an atmosphere where research is an everyday function. And so not only meeting and working with basic scientists, but enjoying the knowledge that they have about the etiology of cancer and how we might treat it better. That permeates into the clinic and into better care for our patients.
I think patients who are unfortunate to have this disease, they have to mobilize all the resources available. Those resources include clinical trials, experimentation, trying to think outside of the box.
Fox Chase, particularly the Department of Radiation Oncology, has been a leader in the field with developing new treatments and new ways to deliver treatments that aren't otherwise available.
I love the idea of being in the lab. I love that, tingling sensation that you get when somebody comes and says, I have new results, do you want to see it? And of course, yes, I do want to see it.
I am very passionate about my job. What drives me is to be able to see my first patient in the morning, to be able to see the next human being that I'm potentially going to help. If I know that the things I'm doing will prevent cancer in some patients, will alter their lives in some really meaningful way, that's the kind of thing that keeps me getting up and doing this every morning.
I love patients, and I love to be in the operating room helping to care for them. And that gets me excited each and every day.
I'm passionate about treating patients individually in a personalized manner.
Outcome is not just survival. There are so many other things that people want besides just living to prevent the disease from taking away your patient's pleasures, and that's probably the most gratifying thing.
This is the kind of stuff that excites me. It's not just the surgery part. It's kind of the development of treatments to the goal is to cure cancer, right?
We truly, as radiologists, can save a patient's life and really alter the course of their disease by finding cancer as early as possible.
The ability to sit down and talk to a patient and really make a difference in their life and give them hope that there's things to do for their cancer is such a satisfying feeling, and it's such a nice thing to do every day.
We're able to guide that patient from the fear of what they have to full recovery, and really that interaction is priceless.
It's also a very traumatic disease, and this is something that can be devastating to individuals. I happen to love the hand-holding that goes with it. And so not only do we take patients through their treatment, but we try to make it as least traumatic as it can be.
Many of my patients live for 10 years, 20 years, 30 years. You can see the patient get better and the family have a big smile on their face. This is a big boost to the morale, and this makes us why we're coming to work every day.
I want to be able to explain things to you. I want you to understand what we're doing and why we're doing things. The more you know, the better you're going to do, and I just think that's just a really good way to take care of people.